Hi, and I'm a clinical psych reg here at Prosper Health Collective. So in today's video, I'm just going to have a very quick walkthrough on what to expect when you come in for assessment. So this covers the cognitive assessment, the comprehensive assessment, as well as the ADHD assessment. So on the day you arrive, you probably say hi to the ladies at reception and be told to wait in the waiting room. And the psychologist, myself included, may come and say hi and to get you to come in. So the camera is currently seated at where we expect you to sit. So this is essentially what it will look like. So you'll be seated at the table here. You may see iPads, your iPad and my iPad. Sometimes you might see speakers that's just hanging around as well. So assessments take usually an hour and a half to 2 hours a session, depending on how quick things go. And it's split into what we call subtests or activities. So usually we can't stop assessments during the subtests or during the activities. But if you need a break, we can have it between the activities. So feel free to bring in water or snacks if you want to. If you want your parents to be waiting out in the waiting room, and if they're happy to wait there, your parents can be in the waiting room, which means that if you kind of want to check in and say hi between assessments, you're more than welcome to do so. So what do the assessments actually look like? Well, I can't show you what the assessments look like, unfortunately, but I can go through a little bit of what to expect. So there are some tasks that we will use the iPads for. So like I mentioned, I've got mine and you've got yours. So sometimes you might get pictures or stimulus that shows up on your iPad. And I might ask some questions about it and you might have to respond. Some of them you can respond by tapping the answer on the iPad, and some of them you might have to respond by telling me what the answer is. It depends from activity to activity as well. Sometimes I will remove the iPad. I'll remove your iPad because I'll still be using mine. And I'll be asking you some questions. So some of the activities will just be me asking questions and you answering questions. And sometimes I might give you a booklet, depending on what test you're doing. So I might flip to a specific page, put it in front of you, and usually I'll give you a pencil as well. It's very common to get a pencil without an eraser. And this is part of the test. So and you will be told on the day as well, but if you make a mistake, just cross it off and keep going. So some tasks will be on the iPad, some tasks will be just me verbally asking questions and you responding, and some tasks will be done on pen and paper. So some tasks do take a while. I think the longest subtest we have takes about 10 minutes. I think that's the longest one. The shortest one takes about 2 minutes. So we'll be fitting in as many activities or subtests as needed. Like I said, usually between an hour and a half to 2 hours per session, depending on which assessment you're coming in for. So some of the common questions I get are, do you have to prepare anything? Not really. If you usually wear glasses, bring them in. If you usually wear a hearing aid, bring it in as well. But usually just start your day as per normal. Try to have a good night's sleep the night before. Have brekkie, preferably. And bring your snacks, bring your water if you want. And if you do need a toilet break or you need a drinks break or you just need a break, usually we can give you a quick break during the subtest. Not during the subtest, sorry. I mean, between subtests or between the activities. The questions usually start off pretty easy and it gets hard pretty quick. So no one is expected to answer everything correctly or even just to answer everything. So what we're generally looking for is for you to give it your absolute best shot and to just try your best. And that's all we're asking, your best effort, so that we'll be able to get an accurate reading of what your abilities are. And there are many reasons to do an assessment, some of which I have explained in the blog that I have already written. So there you have it. This is what you should expect when you come in for an assessment. To be seated at a table, to use iPads for some of the activities, to have pen and paper for some of the activities. And for some of the activities, I'll be just asking questions. There's a few that will use a speaker, and that's because there'll be some audio files will play. And for me to ask questions after each one. And that's about it. So I hope that answers some of the questions on what to expect. And if you feel like you would like to get you or your child assessed, feel free to give us a call and contact us here at Prosper Health Collective. Thank you. Bye.